Well, so to sum up what I said in the previous video, so actually as professionals we have and we should be using two main approaches. So the first one, it's a mechanical method commonly used in science, in scientific context. So we're going to rely on technological devices which offer the opportunity to accurately and relatively precisely measure physiological characteristics or physiological capabilities. The main example again is a biomechanic lab or a physiology lab, where we can use many devices depending on the specific human movement characteristics we want to investigate. On the other side, and I will put most of the focus of this lecture and the following tutorials, we have, let's say, a qualitative approach. So it's like a sequential method where actually we, as a coach, as an S&C coach, we are gonna break down the movement into main key phases. We are gonna evaluate each one individually, and we're gonna consider the interplay, so the connection, the linkage between the many phases we identified in a specific movement, and we're going to evaluate how each one is influencing the following or is influenced by the previous one, and how we can eventually entirely judge the movement based on the overall performance. So now, this is a sort of, let's say, theoretical model, sort of workflow you should keep in mind for whatever functional evaluation or movement assessment process you're gonna run, you're gonna perform with one of your clients, so trainee, athletes, or normal population. So the first step, and this is a very critical one, is the preparation step, where actually you should, let's say, build the knowledge about the performer. So you should create a sort of file about that person, asking the questions, asking for specific documentation if you are talking about an athlete or trainee previously injured, or specifically if you are working with individuals who come to you for the need to threaten specific problems. Let's assume that you will be working with individuals affected by back pain. So in that case, you will be asking for documentation, clinical evaluations, and let's say whatever could be, let's say, could be got from the medical fields. Obviously, the knowledge of the movement, or the knowledge of the tasks you're gonna ask to perform should be fundamental, should be as much as comprehensive possible, in order to understand what could be the weaknesses, the strengths, and functional and non-functional patterns showing up in front of you. The second step is the evaluation itself. So actually the main tool, or the main mean you have to perform a qualitative functional evaluation, obviously, is your eyes. So in that case, the suggestion or the recommendation, the guidelines are to move around your client, to observe possibly from different points, different perspectives, especially let's say matching up with the three main planes of motion. So you should be observing your athlete from the side, so in the sagittal plane, from the front, in the frontal plane, or from the back, and eventually, which is let's say very rare, you should be observing your athlete from the top in order to let's say identify dysfunctional patterns featured by rotational movements. Then we have the reflection phase, or the evaluation and diagnosis. So actually you are going to cross over all the information you got. You have a clear understanding, you should have a clear understanding of the movement, what is let's say a physiological movement, how it should be performed, what are the key components and the key features and characteristics of that movement, and then you're gonna match up or match against these specific guidelines and benchmarks what you have seen, what you've observed with your client, with your athlete or trainee. And obviously based upon these comparative evaluation, you will come up with a specific let's say functional evaluation based diagnosis. So you will understand what actually stands behind a given non-functional pattern, what could be the main causes, and based upon this information you will be prescribing, designing and implementing specific interventions. Ideally the process should be let's say led in one by one, and so again in one-to-one situations where actually the tester should be also the same professional implementing training strategies finalized to let's say improve performances or to rehab, recondition the client. So let's move on, and let's see what actually you will be looking for when performing a movement evaluation process or procedure. So actually we will be looking for errors, mistakes in the movement execution, and we are gonna let's say highlight specific strengths on the performance itself. So as a tester, we should have a sort of ideal movement pattern in mind, and we're gonna firstly compare the performance execution with this stereotype of ideal performance. So in order to flag up specific errors and later on to understand what could be the main causes behind them. So this is something that eventually could be used also for a preliminary stage to inform following quantitative assessments done in a lab, or so just like a first screening level to better and let's say more specifically orient following quantitative assessments. The only thing that we have to keep in mind, which is very important in the in movement evaluation, is the sort of antagonism between consistency and variability. So what is consistency? Usually we look at consistency as let's say the robust repetition of a movement with a very limited amount or very limited range of mistakes. On the other side, as long as let's say the range of the movement execution raises, so increment, we can talk about variability. Usually these two terms are considered as antagonists to each other, but we should keep in mind that in a human movement we have a certain or a given degree of variability, and this degree of variability could be considered in some cases functional, in some cases physiological, so we shouldn't look exclusively to the repetitiveness of a movement as, let's say, a key factor. In some cases, we can assume that the variability about a certain movement pattern could be accepted as, let's say, a strategy to learn something new, a strategy to improve, to enhance the movement itself, or a strategy put in action in response to, for example, an external cue, an external input. With this regard, I want to share with you a specific example by, let's say, comparing two situations which have some ground in common but are finalized to two very different aims. So if we consider one of the most common jump tests, which is the squat jump, where again the athlete is asked to bend, to squat down and then to explosively jump as high as possible. In this case, the main aim obviously is to reach the highest height possible, so to apply the greatest magnitude of forces vertically onto the ground, and then let's say, due to the third law of motion of Newton, the reaction of these forces applied onto the ground will be a pushing action upward to the top height. The same pattern could be used in a very specific sport-related situation, particularly in volleyball, where let's say mid-blockers, so the players in the first line close to the net, where are demanded to block a spike performed by the opponent. So in this case, although the athlete is going to execute a movement pattern very similar to a squat jump, the functional variability of, let's say, the movement itself will allow the athlete to perform either better or worse the specific action based on the demand, based on the specific characteristics of the contextual factors. So actually, could happen that in that specific situation, the jump for maximal height wouldn't be the main aim of the task. Probably the same mid-blocker could jump slightly or even massively lower, but the main aim is to block the ball and then to prevent the ball to be put on his own field. So this could, let's say, let you understand how the movement variability sometimes could be considered as an advantage rather than a disadvantage, rather than a dysfunctional pattern, because athletes, especially in sports scenarios, are surrounded by many external cues, many external inputs, which at the end will massively dictate, will massively, let's say, influence the performance tasks that have to be executed. So, considering the antagonism between consistency and variability, we can, let's say, move to a layer further, and later on during the movement assessment we'll be considering whether or not the consistency or the variability, the dominance of either or is important for the specific task we're gonna assess. So let's assume that our athlete will be asked to perform a new movement, something new, totally new, is faced to or he has to cope with for the first time. Probably in this case, at the beginning, we will be experiencing a very high variability because there is a learning process ongoing. So actually the athlete, in order to fine-tuning his movement, has to learn how to, let's say, to behave from a motor perspective, how to improve, how to make the movement pattern, let's say, more smoother and more efficient. Then we will be looking at the variability across similar tasks. The example could be squat jump against counter movement jump. So we have 3 out of the 4 phases for each of the 2 tasks which are in common, and we will be interested to see how an additional level of complexity of the counter movement jump could influence the 3 previous phases shared with the squat jump. And finally, what we can do, we can compare athletes or individuals in a between subject context. In the previous examples, I've been talking about within subject context, so where actually the athlete, the trainee, the person, the individual is compared to himself or to herself. In this case, in the latter case, we're gonna discuss of between subject differences. So how actually my athlete could be compared with individuals participating in the same sports discipline of different level, different competitive level, different age, different gender. So actually we're gonna compare our athletes with, let's say, people having similar characteristics. Well, let's move on and let's now consider the 3 main, let's say, phases of a movement assessment process. Obviously, the first one should be, as I mentioned before, a phase covering a clear understanding of the person sitting or standing in front of us. So actually what should be very important is let's say the Part2 assessment and the face-to-face interview. So in a Part2 we actually ask our client to fill some information about their, let's say, general or overall health status, just to understand, to identify possible parallel or factors which should be considered when later on we'll be implementing intervention training strategies. Face-to-face interview, this is the, let's say, there is a room for many questions individually and subjectively asked to the person in order to understand what are, let's say, the feelings, the thoughts, the needs, what actually the person feels about his or her specific status, just to complement the let's say, evaluation of the individual, and later on again to create a comprehensive and an overall intervention procedure. Then we have the 2 next phases, which will be fully covered during the tutorials we're gonna run in the computer lab and at the Emirates. So first of all, it's the postural analysis. Postural analysis means we're gonna observe our clients from different points, from different planes, to see how statically and dynamically the human body is, let's say, dealing with and coping with the specific movement tasks. Very similar, we will do with a very similar process, we will let's say accomplish the movement assessment. So the movement assessment actually is based on the breakdown of a specific task into the main components, the main phases, and then we will dig even deeper, trying to understand what are the main demands of each individual phase. There is a stability against mobility demand, and what are the main, let's say, actors trying to, let's say, pursue these objectives. So what are the main anatomic chains, the main functional chains, the main muscles, the main joints involved, and finally, what are the engines of this motion, and what could be the causes of dysfunctional patterns. So, first of all, postural analysis. So, from let's say using a quote from the Latin, postural comes from a verb in Latin which means to place, so to put in place, to put in the right place, or to have a let's say a correct placement. So this is the meaning of posture. Obviously, when observing a client, we can let's say relatively quickly understand whether or not his posture is correct. The evaluation in this case should be done across many stages. So we should observe our client in a standing position and then moving around from side to side, from the front to the back. But if we are, let's say, assisting, or we have, let's say, to work with individuals whose main aim, main needs are related to, let's say, the working place. So probably we should look at these individuals when immersed in the day-to-day or daily working scenario. So let's assume that our client is a computer programmer, and most likely is going to spend many hours during the day in a seated position. So probably the best way to analyze, to evaluate, to judge is, let's say, the correctness of his posture is by observing him in a seated position and looking at the harmony of the joints and the anatomic chains when that specific person is doing his job. In general, let's say that when we identify a lack or something dysfunctional in the posture, we should ask ourselves some questions, and we should try to give answers by following this flow. So a lacking posture, which could be whatever, let's say, dysfunctional pattern in the front plane or in the sagittal plane. Just to give you two examples, I think that you are all aware of what a hyperlordosis means. So actually, when you're looking at the person from a side, we can see let's say an increased or augmented lordosis of the low back. So there is a shift of the pelvis and the waist frontward, and the person is assuming a compensation on the upper trunk, on the upper back, with a kyphotic posture. So in this case, obviously, we have to look at the lack of alignments or ideal alignments of the body structures. Once identified those, let's say, non-functional patterns or non-functional aspects of the human postural characteristics, we can try to understand what are the underpinning factors, the underpinning forces leading to that specific situation. So probably a person having, let's say, a scoliotic pattern where there is a lateral deviation of the column, the racket, probably has an asymmetric force distributions coming from the bottom of the feet. So this asymmetry in the forces is likely to cause, let's say, an asymmetric orientation of the lower limbs, causing as a chain an asymmetric orientation, a different height of the hips and the pelvis of the iliac crest, and this obviously will be compensated by a scoliotic attitude, a scoliotic pattern in the upper back. So just to sum up, at the end of this chain-like flow, we will be looking at say faulty joints positions and how these structural non-functional patterns are going to influence the movement and the movement efficacy. Well, as mentioned before, the three main planes through which the postural analysis and the movement assessment process have to be performed are the anterior view, so a view from the front or from the back. Obviously, in both cases, we could, let's say, identify problems occurring in the frontal plane, so lateral or side deviations of the upper body, the trunk, or of the lower body. Let's assume again the case of a scoliotic person. Probably what will be flagging up is an asymmetry of the shoulder heights. There is an asymmetry of the pelvis. There is probably an internal rotation with a valgus pattern of a knee with a pronation of the ankle. And again, this could be easily identified by looking at the person from the front or from the back. The second plane, or the second point to be considered, or to the second spot, let's say, to where to stand when observing a person and performing a postural analysis and a movement assessment, is the side. From so we can look at movement patterns and postural characteristics in the sagittal plane. So again, the main two of the most common non-functional patterns or postural deficiencies, which could be easily identified by observing someone from the side, is hyperlordosis or hyperkyphosis in the lower and upper back respectively, which is not far away from what S&C coaches and strength trainers usually do when observing, or even personal trainers do when observing trainees in the gym performing let's say a squat or deadlift or clean and jerk exercises. Well, for those who are interested, let's say, to cover in much more details these aspects of the postural evaluation, I can address you to this book, available in the library, so you can have comprehensive understanding how the performance assessment, the postural assessment is commonly done. Let's move on. So let's move to the next and the last let's say last phase of the movement assessment. Before proceeding, I have to do a premise when saying that actually, although the human body is, let's say, made by different units, different segments, so the different joints of the body, the upper part or the upper half, the lower half, we should consider a movement as an integration of all these units or these components, because at the end of the process a movement could be considered as the outcome of a teamwork, like a chain like based task, where each individual unit is interconnected with each other and is going to be influenced by the previous, and is going to influence the functionality and the effectiveness of the following in the chain. So if we consider the graph on the right side, you can see how eventually forces produced by the interaction of the bottom of the fifth, so the fifth with the ground, is going to have an influence, let's say, step by step on all the different structures above the feet. So from the feet to the ankle, from the ankle to the knee, from the knee to the hip, and up to the top of the body, either considering the upper limbs or the head. So when we are analyzing a movement, we should consider this, let's say, harmony, or this continuous and repetitive interplay between the different units of the human body. Well, and this could be, let's say, easily understood by considering